Hi there. So it's been a long time, I know, since I posted anything, but I wanted to check in and say hi and talk about a few things. So it's been, I don't know how long it's been. I'll have to look and see, but I think it might even have almost been a year since I posted. So yes, I am still doing Bright Line Eating. I am currently nursing a baby. So I've actually done Bright Lane Eating through a pregnancy now, and I am now doing Bright Lane Eating while nursing. So things are definitely different than the last time that I posted about my Bright Lane Eating journey. And yeah, so by the numbers, I think probably about where I was at, maybe a little bit heavier than I was the last time I posted a video. I'm not quite back to my pre-pregnancy weight. I still have about 10 pounds to lose from my pregnancy. And my baby is about 2 months old. So I'm definitely feeling anxious to lose that weight, but it's definitely a lot harder to lose weight while you're nursing than it was before my pregnancy, that's for sure. So that's probably the big thing right now. Is my big challenge is how to do Bright Line Eating, particularly the weight loss plan, while I'm nursing and trying not to, lose my supply, because that makes the baby really cranky, and that's makes me really cranky. So I have gotten some coaching around that, which has been amazing. I'm a Bright Lifer, so I have access to those kinds of things, those resources, the people who can really help, and that's been amazing. So basically what I do right now is I have a 5 meal day plan, and that gives me enough calories and eating frequently enough throughout the day that I can maintain my milk supply for my infant. So as far as Bright Line Eating during pregnancy, let's talk about it a little bit. So it was definitely harder than I don't know if I expected it to be easier, but it was definitely hard. So the biggest thing for me with Bright Line Eating during pregnancy was actually not it wasn't like cravings or, like, oh, I've got to eat whatever because I'm pregnant. It was actually food aversions, making it really hard for me to eat enough food. So, I couldn't really look at a vegetable. It just made me so nauseous to even just think about it. My normal breakfast made me sick. I usually eat eggs and oats and fruit for breakfast, and I could not do it during pregnancy. It just, the whole thing made me so sick. So there were times where I was just living on Ezekiel bread toast and avocado, and just eating that because it was the only thing I could eat. And then as I was going through my pregnancy, I started having some issues where my baby was not measuring the way that the doctor wanted her to. So she was measuring really small, and so the doctor's like, you have to eat more. And so I had to eventually really up my plan by a lot to just accommodate trying to get my baby to grow, which was really stressful. And I don't actually know how much your baby's growth actually corresponds with anything that you can do personally. The research seems pretty bad. It doesn't seem like that's actually really a thing, but I think it's the only recommendation they can have. Like, oh, your baby's small, like, eat more. So, I did. So I put on some weight, and she eventually put on weight too, and we were both fine in the end. Kind of a crazy birth story. So I have had one previous successful birth. As you know, if you've seen my videos, I've had a lot of pregnancy losses as well. But I do have one other child, and she was born via C-section. And so I was trying to have a vaginal delivery with this birth, and it was like every single thing was like going against me. First, it was the intrauterine growth restriction diagnosis, and they were saying that they were going to have to induce me early or do a C-section early. And that if she was too small, they'd just have to do a C-section because she wasn't going to tolerate labor and all this stuff. Anyway, she finally caught up with her growth, and then it was, oh, you have polyhydramnios and you're at risk for prolapse, and so you can't go, we have to give you a C-section so that you don't have that issue. And then I eventually changed care providers because my care provider was like just so sure that I was going to have a C-section. I didn't want to. And I found a provider who was willing to induce me, which was awesome, because a lot of providers won't do inductions for VBACs. So all was well. We were going to do it. I got to 40 weeks and she was breech. Of course she was breech. So at that point, what we did was schedule me for a C-section. I show up for my C-section, and in the waiting room before we went back for the surgery, she actually flipped. So I avoided having a C-section, just barely at the last second. And she was born the next morning, around 2:30 in the morning, and got the VBAC that I wanted. So that was awesome. It's taken me some time to kind of get really back in the groove with, changing my food plan and getting everything together there. And then it's just really hard with a new baby and everything else. So definitely my lines have been wonkier than they were previously. It's been a lot harder. But I have a lot of support still, and that's been amazing. And I also am... I feel like I'm getting there. I'm getting back into the groove. Weight loss is significantly slower than it was before. I think I lost like 70 pounds in 7 months or something before I got pregnant. And so, I'm definitely not losing at that kind of rate anymore. I'm like half a pound a week right now. So, I don't have control over that. So it is what it is, and I just kind of have to deal. So we're just going with that. I'm just sitting here nursing. So I'm going to go and finish that up. And I just, I've been trying to film a video for a long time, and I just can't because every time I try, she cries. And so I just figured I'd do it while nursing because she's happiest that way. So anyway, I will talk soon. Bye.